Hello everyone. In this video we're going to talk about amiodarone as an infusion. We're going to talk about when to do this, and we're going to talk about some specialized equipment needed to run it properly and the steps to set it up. The first scenario where we could use amiodarone as an infusion is in wide complex tachycardias that are stable. So if we have a patient who isn't showing hemodynamic compromise but has a wide complex tachy that isn't perfectly monomorphic and perfectly regular, there's a high probability that that is a ventricular tachycardia or could be some kind of undifferentiated wide complex tachy. Now, if we have a long transport time with this patient or there's a risk that the patient will deteriorate, we should consider amiodarone as an infusion under consultation with online medical support. So if online medical support gives us the green light, we're going to run an infusion of 150 milligrams of amiodarone over a 10-minute period. And later on in the video, we're going to show you how to set that up. The second scenario where we would use amiodarone as an infusion is as per C02 advanced resuscitation. So in the case of return to spontaneous circulation, particularly in those patients who were in a VFib or pulseless VTAC arrest, if we achieve ROSC before administering amiodarone as a bolus, it's a good idea to consider amiodarone as an infusion to help prevent the patient from going back into one of those dysrhythmias. And so in those cases, we're going to administer 300 milligrams over a period of 10 minutes. Now, the problem with amiodarone is that it's not very soluble in aqueous solutions. So when we mix it with IV fluid, amiodarone has a tendency to crystallize. Now, the crystals amiodarone forms are needle-shaped. And so if that's administered to our patient, those needle-shaped crystals can cause phlebitis. And so we call this amiodarone-induced phlebitis. And to prevent that, we're going to use a filtered IV line to catch the crystals before they enter the patient's body. So this is a filtered IV set. And at first glance, it looks just like a regular IV set. So at the top, we have our drip chamber, of course. It's got a vent cap on it. We want to make sure that vent cap is closed at all times. The only time that would be open is if we're using glass bottles to infuse a drug. The drip chamber is a 15 drip per ml set, so we have to remember that when we're doing drip calculations. As we go down the line, we've got slide clamps, we've got ports, this section here that fits into the B-Bron infusion pump, and then we make our way down the IV line. We get to our roller clamp. So far everything looks the same until we get just beyond the roller clamp and we see this piece right here. This is the filter that filters out the crystals we were talking about earlier on in the video. And so this is the only noticeable difference in the IV set. Now keep in mind there is an added cost to these IV lines, and these IV sets don't need to be used on every infusion we're doing, just in the case of amiodarone for now. Futuristically, there may be more drugs that need filtered lines, in which case the setup would be the same. But for now, we're only using these for amiodarone drips. As we continue down the line, we've got another med port and a slide clamp. And we get to the end, and of course we have this anti-siphon valve, which we're going to have to remove if we want to run our infusion by gravity, and of course we are. So remember to take that anti-siphon valve off, otherwise you won't be able to prime this line. So the first thing we're going to do is start preparing our IV setup. So I've got a brand new bag here, just taken out of the packaging. I'm going to spike this IV bag with the filtered IV line, just like you would any normal IV bag. So we can see the filter close up here. It's got some small channels that the fluid runs through, and of course the white filter that's going to filter out all those crystals we talked about earlier. The next step we want to do is prime this IV line. So we're going to make sure all of our clamps are open, of course, and we're going to have to remove this anti-siphon valve and make sure that we get all the air out of this line. Now, if you haven't already got an IV in situ, you're going to need to start one, obviously. So in this case, I'm starting a new IV line, and I've got an extension set that I've pre-flushed with a pre-filled syringe, and I'm going to give this a flush to make sure it's running properly. If you already had an IV running, you would essentially do the same thing. You're going to disconnect your current IV from the extension set, and then a good idea just to give it a good flush to make sure it's working properly, and to flush out any other medications that may be in the line before you give your amiodarone infusion. From there, I'll secure this IV line in place, and then we'll connect the filtered line. Okay, now with my IV secured, we can connect our filtered IV line to the set. So we're going to remove the anti-siphon valve and connect our IV line to the extension set. Then we'll secure the IV line with some tape to make sure it doesn't get pulled away. So now that our IV is ready, we need to set up for a piggyback of amiodarone. And so here's a few of the items you're going to need to do that. So of course, obviously, first thing we need is amiodarone. Now in this case, because it's a wide complex tacky, we're giving 150 milligrams over 10 ml. So I only need one vial. If this were a ROSC situation, we would need 2 vials or 300 milligrams. Again, run over 10 minutes. But in this case, we're only needing the one. So because we're only drawing up one, I'm going to use a 5 cc syringe and a needle to draw up the medication. I'm also going to need a medication added sticker, which we're going to place onto our mini bag, which has all the information we need. And of course a mini bag, 100 cc mini bag in this case. And the last thing we'll need is a secondary medication set. Now, if you're using the Baxter secondary med set, it is a 10 drip per ml set, and so that will change your drip rate calculation versus the B-Bron, which is 15 drips per ml. So we're going to wash our hands, we'll get some gloves on, and we're going to set this up. So we're going to start by drawing up our medication. So keep in mind, amiodarone is a high alert medication, which means we need to do independent double checks on dosage and administration. And so both you and your partner should be double checking the dose and the setup before we start administering to the patient. Okay, so we're going to start with amiodarone. In this case, we've double checked it, and we need to give 150 milligrams. So we're going to draw that up in a syringe. Now keep in mind, amiodarone is detergent based, so it will foam up if you draw it up too quickly or if you push air through it forcefully. And so we want to make sure we're doing this kind of slowly compared to what you're used to for other drugs. Otherwise it'll foam up in your syringe and be essentially useless for you for a long time until the foam goes away. So we're going to draw out all the contents of the vial and remove any air from our syringe. And you can see we've got a nice clear solution there of amiodarone. Next step is to mix the amiodarone in our mini bag. So in this style of mini bag, we've got what looks like a vial top on here, and that's where we're going to be adding the medication to the bag. So we're going to insert the needle into the vial, and we're going to slowly push the amiodarone into the bag. Keep in mind, again, because it's detergent based, if I force the amiodarone into the bag, it's going to suds up like soap. So we want to do this nice and slowly. And you can see here there's no bubbles forming, which is good. And we want to make sure to mix the medication in the bag so that there's a good mix throughout. And so to do that, we're just going to gently mix the bag. Again, if I forcefully shake this, it's going to cause foaming inside the bag. We're going to get a lot of bubbles. Okay, so just a gentle mix like this is perfect. The next step is we're going to get that medication added sticker in place. Okay, the next step for us now is we're going to put this medication added sticker onto the bag so that anyone else who might be taking care of the patient will know exactly what's running into this bag. Keep in mind, it's a high alert medication, so both you and your partner need to initial this tag once you're confident that everything on there is correct. So we're going to add the tag to the bag, and then we're ready to set it up as a piggyback. So now that our mini bag is ready to go, we need to hook it up to a secondary infusion set to connect to our main line and run the drug. So we're going to open up our secondary infusion set, and inside we're going to find a shortened IV line and a blue hook. And we're going to show you how to use both of those items next. So we've got our mini bag hung up here ready to go. We need to spike it now with our secondary IV line. So the secondary IV line looks just like this, like a regular IV setup. We've got a drip chamber. Now keep in mind, as I said earlier in the video, this drip chamber here is a 10 drip per ml set, which is what we're used to. So when we're doing the math and our calculation, as far as our drip rate goes, we have to remember the 10 drip per ml. Further down the line, we've got a single little roller clamp here. This is basically just to turn the infusion on and off and to help us prime the line. And then we have a lure lock on the end. So we're going to spike this bag. And we're going to prime this line, get all the air out of it, and then it'll be ready to set up and attach to our primary line. Now, in order for this mini bag to run before the primary, I need the mini bag hanging higher than the primary bag. So the primary bag needs to be lower, and that's where this blue hook comes in. So what I'm going to do is I'm going to take this blue hook. There's a looped end and a hook end. The looped end goes into my hook in the truck, and I can either hook the bag down here on this hook, or if I need a little more vertical space, I can run the bag up to about halfway onto this blue hook and set everything in place here. Now the primary bag is hanging much lower than the mini bag, so the mini bag will run first. Now that my IV bags are hung at the proper height, I'm going to connect the piggyback line to the main IV line. So I have both my IV lines clamped off right now. I'm going to take an alcohol wipe and I'm going to clean the very top port of the primary line. We'll give that a second to dry. I'm going to take the cap off of my piggyback line and I'm going to connect the two together. So now the piggyback is attached to the primary line, and I can open up the roller clamp on the piggyback, and we're going to open that all the way. We're not setting our drip rate with this mini roller clamp off the piggyback line. We're going to be setting our drip rate with the roller clamp on the main line. Alright, so I've got the roller clamp on the primary line shut off, and I've got the roller clamp on the secondary line open. So now if I open up the primary roller clamp, the drips should come from the mini bag, which is hanging higher. So we'll start it now. You should be able to see drips coming from the mini bag, not coming from the primary bag, again because this bag is hanging higher. If I was to lower this bag, you would see that the drips would actually start coming from eventually from the primary bag, and you can see the primary bag is dripping now that I've got this mini bag hung much lower. So we always want to keep the mini bag higher than the primary bag. So now we're going to use the roller clamp on the primary line to set the drip rate coming from the piggyback. Now we've got 103 mLs in this bag. We're going to run that over 10 minutes and we have a drip factor of 10. So 103 mLs times 10 drips per ml gives us 1,030 drips. And over a 10-minute period, that means we're going to give 103 drips per minute. So next I'm going to show you a quick trick on how to do that. So many of you who've taken courses with me before have seen me use this trick, but what I'm going to do is use a metronome to help me set my drip rate. So I've got my metronome on my phone set to 103 beats per minute. I'm going to make the beats match the drips, and that's going to give me 103 drips per minute. Now, in cases of return of spontaneous circulation where we didn't give amiodarone to the patient before achieving ROSC, the only thing we would do different in this setup is we would add 300 milligrams of amiodarone to this mini bag and run it over 10 minutes. And so the only difference being we're adding an extra 3 mLs. And so 106 mLs with a drip factor of 10 running over 10 minutes would be 106 drips per minute. Otherwise, the setup is identical. All right, now that this is running, we just need to check on the rate every once in a while and make sure it's still running properly. After 10-minute period, this bag should be finished and the primary bag will take over. From there, we can disconnect this piggyback line from the primary line and we can continue using the filtered IV set for the rest of this call. Keep in mind the filtered IV lines are only to be used for cases where we're doing amiodarone infusions. If you have questions about this or any other clinical topics, contact your clinical managers.